What do you think, Dr. Yao?
Yes, I think it has more of a hemangioma
Yes.
appearance.
Yes.
And when hemangiomas are this large,
Yeah.
they lose the typical uniform echogenicity
Exactly.
pattern that it has.
Exactly.
It may have some hypoechoic changes also showing
Yes.
because of the size of the hemangioma.
Exactly.
Okay. So we have now very huge focal lesions.
And
Most
in
prob-
spite of this lesion is very big and surrounded with a lot of major vessels, however, if it shows no malignant behavior,
Yes.
right?
Yes.
It doesn't go through a vessel, a vein, or an artery, or the
Exactly.
portal vein or hepatic veins.
Exactly.
Right?
Yes.
So this is more with benign nature, more with hemangioma,
Yes.
right?
Yes. Exactly. It's more with benign behavior.
So what's next for this patient? Do we go for biopsy or do we go for triphasic CT scan? We have to back to the guidelines. Ahmad, Dr. Ramadan, Dr. Yasmin, in evaluation, the final evaluation, this patient, general condition is perfect. She is not cirrhotic, as you see, she is not cirrhotic, and she is having a huge hyperechoic focal lesion with more or less benign behavior. So what's next? How can we confirm the final diagnosis here?
Or dynamic MRI or contrast
Again.
enhanced. I proceed for contrast enhanced imaging,
Yes.
whether CT or dynamic MRI or contrast
Yes.
enhanced
According to-
ultrasound.
So that
If I reach the diagnosis, whether giant hemangioma, fibrolamellar hepatocellular carcinoma, or cholangiocarcinoma,
yes.
especially in this case, we have a normal background liver parenchyma, not a cirrhotic patient. For mostly we're dealing with hemangioma or large hemangioma or fibrolamellar type of HCC. If the imaging or contrast enhanced imaging delineating the pathology, so we'll have a diagnosis.
Okay.
If it is indefinite for the diagnosis, we'll proceed for the biopsy to
Exactly.
have a final diagnosis for this case.
So the steps is like, according to the guidelines, we proceed for contrast enhancing imaging, either MRI or CT scan,
Yes.
to verify the nature, verify the vascular pattern of this kind of focal lesion. If any doubt, we have to proceed
For
for
biopsy.
So, is the biomarker here is having a role, implementing a biomarker here?
I don't think so. Yani if we have a normal, if we have a normal alpha-fetoprotein or a tumor marker, it is not excluding a malignancy. If we have a high level of alpha-fetoprotein,
If you have shooting alpha-fetoprotein,
we are saying it is a malignancy or it's vascular invasion. But if a normal tumor marker is not excluding the malignant nature of the lesion, so I have a
Yes.
definite diagnosis, not
Yes.
depending only for tumor marker. As
Yeah.
you said, if we have a shooting tumor marker, alpha-fetoprotein, it is delineating with more or less with malignancy and delineating vascular invasion. If with normal tumor marker, we will proceed for dynamic imaging as
thank you.
things.
Thank you very much. Dr. Yao, would you like to add anything?